A bunion is a structural abnormality of what's called the first metatarsal bone. And often people come into me and they say, I have a bump on my foot. Well, when I look at that bump, I'm looking at it in a completely different way. They look at the pain, the redness. What I look at is the structure. And what people don't realize when they have a bunion is they tend to just concentrate and focus on that bump. But what it's really more related to is the hereditary of that patient's foot structure, which almost always has come from someone. And surprisingly, I'll talk to people, and for a lot of people, it's not their mother or their father, it's a grandparent. For some reason, it seems that it skips a generation. But what we do when we evaluate a bunion is I'm looking at what's called the angle. And basically, what happens is the first metatarsal bone tends to bow or to move away from the second metatarsal bone, leading to what the person sees in their deformity. When I look at it, I evaluate that structure, and that is what dictates to me what it takes in order to correct that deformity. And surprisingly, most bunions are correctable in a way that the patient can stay weight-bearing, that they're able to generally get back into a shoe within about 3 to 4 weeks, and really with not terrible disability. There is a subset that require a period of non-weight bearing, and again, it's all based on that angle. That's what dictates the deformity. My advice to people that are starting to get discomfort is, of course, always to try a wider shoe first or soaks. But if it seems that it's becoming more of a daily event, more of a chronic nuisance, to come in and have it evaluated. Because the reality of a bunion is that over time, the structure will gradually get worse. And while you might not see it because you look at it every day, as that structure gets worse, the correction does become more complicated. And our goal is always to fix these in a way that we keep our patients ambulatory and get as good a correction as we can.